Let me set the scene. You've been indoors, the air conditioner humming, the room perfectly cool.
But suddenly your throat feels dry, your nose starts acting up, your head's heavy, and you're wondering, is this a cold or is the air conditioning to blame?
It's a question I hear often, so let's break it down clearly, just like I would in the clinic. Chapter 1. What is air conditioning sickness? Air conditioning sickness isn't an infection, but it can make you feel unwell. Cold, dry, recycled air irritates your airways, dries your skin, and can leave you feeling fatigued, even though you aren't technically sick. Chapter 2. Cold versus AC sickness. How to tell the difference. When patients visit me with these complaints, here's the checklist I use to help them figure it out. 1. Dryness, skin and eyes.
Dry air from air conditioning often leaves your skin tight and your eyes irritated.
A cold usually doesn't cause this kind of dryness. 2. Fever. A common cold often comes with a mild fever because your immune system is fighting a virus.
With AC sickness, fever is uncommon.
3. Aches and chills. Muscle aches and shivering, especially under a blanket, are strong signs of a cold.
Air conditioning might make you feel cool, but it won't cause body aches.
4. Environment test step out of the air-conditioned space.
If your symptoms ease quickly, it's likely the air conditioning causing discomfort.
A cold, however, will follow you everywhere no matter where you go. 5. Is it contagious? Colds spread from person to person. That's caused by a virus.
Air conditioning sickness is triggered by your environment, not something you catch from others.
Chapter 3. Doctors' simple solutions for AC sickness. Now, if air conditioning is the culprit, here's what I recommend.
First, use a humidifier. Maintain indoor humidity around 40 to 60% to protect your airways and skin.
Second, stay hydrated. Drink water regularly to keep your body's natural defenses strong.
Third, avoid direct airflow. Adjust vents so cold air doesn't blow directly on you.
And lastly, take short breaks outdoors. A few minutes in fresh air can help reset your system and ease symptoms. Chapter 4. Final takeaway. If you've ever noticed you feel off after a day under air conditioning, share your experience in the comments. And if this video helped you understand the difference between a cold and AC-related symptoms, click like, subscribe for more doctor-approved health tips, and share this video with someone who always says, "I think the AC is making me sick." Now you know why.
Thanks for watching, and see you in the next video.